LA County hospitals are seeing a significant rise in flu cases. Experts say it's one of the worst seasons in California since 2020. And not just here, there has been a steady increase across the country. Dr. David Bronstein is an infectious disease specialist with Kaiser Permanente Antelope Valley, and he joins us now with more. Good morning. Thanks for being here. I know you're busy, especially busy. So you've actually been seeing more cases now than even in December. Talk about what you're seeing and why you think this is.
Yeah, we're seeing a ton of flu right now. We were hoping in December, around Christmas time, the numbers did start coming down a little bit. And then all of a sudden, past few weeks, they really started spiking up. And now there's really no end in sight. We're seeing lots of people coming in with flu. We're actually seeing, if you look at the country as a whole right now, we're actually seeing more people being hospitalized and passing away from flu than from COVID right now, which is really the first time we've seen something like that since the pandemic.
Wow. I mean, it's a serious illness. It can be deadly, as you said. Absolutely.
I know we always think of flu as runny nose, cough, congestion, fever, maybe some vomiting, maybe some diarrhea, but that's if you're lucky. The scary thing about flu is the complications from flu. So it can go to the lungs and cause pneumonia. That's really the biggest complication we see. But over the years, I've seen flu, especially in kids, go to the brain, go to the heart, and kids can pass away from flu just like elderly adults can.
Is it too late to get the vaccine right now? And then there's always a question every year about, is this the right strain of flu vaccine? Is it worth getting the vaccine?
Definitely not too late. This is actually the perfect time. You want to get the flu vaccine as soon as you can, and knowing that the numbers are going up and up, it's a perfect time to protect yourself, protect the people you care about. This year with flu, we're actually seeing multiple strains of flu going around at the same time. So we've got H3N2, H1N1, and we're starting to see flu B on the rise as well.
Great.
So yeah. But even if you had one flu infection earlier in the year and you think, oh, I got the flu, I'm fine, that's not enough, because you can get sick again and again with different strains of flu. The beauty of the vaccine, it covers all three strains. So definitely not too late. Even if you have the flu, great time to get the vaccine to protect you against the strains that you haven't had yet.
And you said there's no end in sight. Is there a flu season anymore?
Hard to say. The past few years have been very variable. I know when we saw a ton of COVID, we were seeing less and less flu. But right now, you would expect the winter time to be flu season. But every year, that can kind of trail off. And you can see into sometimes springtime, especially with that other strain of flu B that comes a little bit later in the season. Once you think you're done, it may keep going. So again, perfect time to get the vaccine if you haven't done that yet, because flu's still out there.
And why do you think pediatric cases are especially high? I mean, I know schools can kind of be petri dishes and daycares and things like that, but is this unusual?
I wouldn't say it's unusual. Kids usually are, I think of them as mosquitoes. They're the ones who get the virus and do spread it to other people. And if you can just immunize all the kids, you can actually prevent a lot of the illness in older folks as well. But kids, unfortunately, kids can have some pretty severe complications with flu.
Okay, so do you think that the immunization rate is contributing to the rise in flus? Are fewer people getting the shot?
It's definitely not helping. I think if we could really bump up those immunization rates, we actually wouldn't be in the mess we're in right now, and we'd be seeing a lot less flu. So that's part of it. We're unfortunately immunizing less people of all ages, but not too late. We can really improve those numbers.
And what else should we be doing besides the immunization before I let you go?
Well, the vaccine's the most important thing, and there's really no replacement for that. The big thing, though, is if you're sick, stay away from people. So don't go to work if you're sick. Don't send your kids to school if they're sick. You know, do hand washing, wear the mask if you're in crowded indoor places. Anything you can to prevent spreading the virus to other people is very important, but there's no substitute for the vaccine. And so that's the best way to not get the flu to begin with. And even if you do get the flu, remember the vaccine, you can still get the flu, but it's really going to protect you against the complications, the hospitalizations, and death from the flu. So the vaccine's really the way to go, and it prevents transmission as well.
All right, David Bronstein, thank you so much.
Great, thank you.
We appreciate it.